This isn't a topic that most of us really like to talk about, especially those of us in elder care. Our staff is usually kind of, reserved about the topic. And so, like my subtitle, "Ew, Grandma and Grandpa do not have sex," that's usually the attitude that we face. And how many of you already have your fingers in your ears going la 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 la, even the thought? So what we're going to cover, obviously this is a really broad topic, so we can't cover everything, but we're going to identify a few myths about sexuality in our aging population, describe changes expected to occur as we age and the barriers and challenges these changes present to sexual health, and identify ways to assess and promote the sexual health of older adults, especially sexual behavior in elder communities and sexual behavior when dealing with dementia. Okay, so here's the problem. There's a general discomfort in discussing sexual issues in the US, and healthcare professionals are typically not educated to manage sexual health issues of older adults. Sexual health is often ignored in the assessment of older adult health. A lot of times, having been an ED, an administrator in assisted living, it's not on our list of things to ask what their sexual preferences are, or what their focus is, or do they even want to discuss it? And a lot of the reason for that is the stereotypes that we have all embodied throughout our lifetimes when it comes to aging. Ageism is the one ism that affects everybody. There are a lot of isms. There's racism, there's alcoholism, traditionalism, existentialism, there's baptism, but ageism is the one that we are all exposed to, and it becomes ingrained in us when we're very young. A lack of education, experience, and negative attitudes towards aging sexuality results in an inability to meet sexual desires and maintain sexual health. So let's see what you think. Let's look at the first one. Sexual activity in aged persons is often dangerous to their health. True or false? Anybody? Is sexual activity dangerous?
False.
Thank you. That one. All right. It's, for the most part, it's definitely false. Sex definitely has physical benefits. Seniors are encouraged to be active and move their bodies, and sex counts too. For older women, sex can help strengthen vaginal tissue and pelvic floor muscles, which helps ward off problems such as incontinence and prolapse, and it can actually help lower the risk of hypertension. Anxiety and fear regarding sexual activity are prominent, however, among those with heart problems. Statistically, shoveling snow is more likely to trigger a heart attack than sexual activity, but both are rare, so this is not an excuse to not shovel snow. So, true or false, STDs are more prevalent in elders than any other segment of population?
True.
Not quite, but it's definitely up there. It's still more prevalent in younger people between 15 and 24. However, the rise of STDs among seniors over the past 5 years, especially over the age of 65, show that chlamydia and syphilis have nearly doubled, and gonorrhea cases have almost tripled. So sexuality is typically a lifelong need. Oh, come on, somebody's got to answer.
True.
Exactly. Sex makes us feel alive. Obviously, it's a personal thing, but it is true. It also helps us live longer, and frankly, as we get older, we get better at it. There is evidence that sexual activity in older persons has beneficial physical effects on the participants.
True.
True.
Yes. Consistent sexual expression has been found to reduce physical and mental health problems associated with aging. Advantages of an active sex life include stronger libido and sexual confidence, stress relief, lower blood pressure, lower risk of a heart attack, improved sleep. It counts as exercise. In women, more sex promotes vaginal lubrication and elasticity, and it also helps improve bladder control. Erections and ejaculation can reduce prostate cancer risks. It promotes higher levels of antibodies that protect us against viruses and bacteria, and orgasms have been linked to pain reduction. Bet you didn't know all that, huh? Let's see. And I just lost one. Okay. The sex urge typically increases with age in males over 65. All right, that's false. Just like with everybody, it's natural for men to notice a gradual decrease in sex drive as they age. Same with women. The degree of this decline varies, but most men maintain at least some amount of sexual interest into their 60s and 70s, and sometimes loss of sex drive is related to an underlying condition. There is an inevitable loss of sexual satisfaction in postmenopausal women. Oh, nobody?
You have some shaking heads, and I've seen some going up and down and some going side to side. So we've got a mixed bag here.
It's physically, it's false. Studies of effects of menopause on sexual functioning suggest that it's how women feel about menopause rather than menopause itself that determines their effect it may have on their libido.
And if I may, I think it also has, there's an effect on the physical changes.
Oh, sure.
That lubrication is not what it used to be, so sex can be painful.
Yeah, and there's definitely some issues, but it's not necessary. It's not things that can't be overcome or
Addressed.
You know, exactly. So, okay, and the next one, prescription drugs may alter a person's sex drive.
Mm-hmm.
Definitely.
Absolutely. Certain antidepressants, including SSRIs, blood pressure lowering drugs, and oral contraceptives may lower sexual drive in many ways, such as decreasing available testosterone levels or affecting blood flow. And then in the absence of severe physical disability, males and females may maintain sexual interest and activity into their late 80s and 90s. It's true. People don't have an expiration date on their sex lives. Sex and arousal change over time. They may be less intense, but they don't disappear. Okay, sexual health is important to individual self-identity and general well-being. It contributes to satisfaction of physical needs, fulfills social, emotional, and psychological components of life, and evokes sentiments of joy, romance, affection, passion, and intimacy. But let's face it, elder sex is not necessarily dinner conversation. Dementia and the capacity to consent. Dementia causes changes within the brain, therefore it is likely to cause changes within sexual relationships. Affects relationship memories, abilities to limit, control emotions, impulsive speech, acting out. I think we've all dealt with that. Hypersexuality and sexual disinhibition. Clinically significant level of desire to engage in sexual behavior. But issues of consent. Issues regarding consent often arise when one or both partners have diminished cognitive capacity. Presence of dementia at varying stages of severity poses challenges in determining capacity to consent. However, cognitive impairments don't necessarily eliminate one's ability for recognizing their desire for intimacy and pursuing a meaningful relationship.